Hi there, I'm Dr. Theresa Stigen, and I want to welcome and thank you for tuning into this presentation on how to heal your fertility. Now, right off the bat, I just want to say that this talk is meant to be watched by a couple together, because it really does take both husband and wife to get the most out of this presentation. For one thing, we're going to be taking an hour of time together, and the amount of material that we're going to cover is enormous. So it's really going to be tough to try to explain to your spouse what you heard in a way that makes sense to them, the same way that it made sense to you. And we want to make sure you both are on the same page. Infertility can be a challenge to a relationship sometimes, and it's important to keep close to each other through those challenges. Because let's face it, what good is having a baby if you lose each other in the process? We don't want that to happen. So if your husband or your wife isn't with you right now, just pause the presentation, grab them real quick to join you, and then cuddle up and learn together about how you can heal your fertility. Now, as I said, we're going to cover a lot in this talk. By the time you're done watching this, you're going to know more about how to tackle infertility than most doctors, even doctors who consider themselves to be a specialist in infertility. Now, that may seem like a tall order, but I think you'll see by the end of this why I feel so confident in saying that. So here's what we're going to cover. First, we're going to investigate the shocking truth about what most people consider to be the most effective treatment for infertility, in vitro fertilization, or IVF, and whether it can live up to the hype around it. And here's a spoiler alert, it can't. Second, we're going to reveal the two major pitfalls you'll encounter in our healthcare system's approach to infertility that stick you in an infertility rut and how you can avoid them. Once you free yourself from these mind traps, you will be empowered to find real solutions for your infertility. And finally, we're going to talk about a comprehensive and systematic method that you can apply to unlock the mysteries of your fertility using the 3 keys of healthy fertility. With these 3 keys, you will be able to rejuvenate the fertility your body was created for. And when we've gone through all that, and you've become more educated about how to overcome infertility than most doctors, I'm going to give you an opportunity to take what you've learned and put it to work for you. Because this just isn't about learning and knowledge. This is about a clear and effective plan that you can put into action right now to meet your needs as a couple. Does that sound like something you're looking for? Would you like to take this new expertise that you'll have about fertility and make it work for you? Yes and yes, right? So I'm going to make sure you have the opportunity to do that before we come to the end. Now, please understand, as we get into the thick of it here, that I'm a board-certified OBGYN with a specialization in natural solutions for infertility. I did extra training beyond my regular OBGYN education to become an expert in fertility. But a lot of what I'm going to say right now, other board-certified OBGYNs would know nothing about. Well, why is that? Did they just squeak through medical school and residency and then get turned loose on an unsuspecting public? Well, no, they're probably excellent physicians. So why don't they know anything of what I'm about to tell you? It's because of the faulty training they received. I know, because I had that training too. The only difference is I went looking for other answers because I just wasn't satisfied with what I was being taught. Because you see, about 90% of what I was taught about infertility during my 8 years of medical training was completely worthless. Now, does that sound shocking to you? I mean, my goodness, a board-certified OBGYN is telling me that 90% of her training in infertility was useless? What are they teaching in medical school these days? You know, that's a great question, and we're going to get to that very soon. But look, my point in saying all this is twofold. First, don't get mad at your regular OBGYN who doesn't have a clue about what we're going to talk about here. It's not their fault. They just were never taught any of this. They should have been, but they weren't. And second, I'm hoping you'll cut me a little slack too. Because sometimes people get a little upset as I go through this material. They feel almost robbed that they haven't heard this before and can understandably be upset about it. But remember, I'm just speaking to you right now as a messenger. And remember what they say about messengers. Don't shoot the messenger. Right. So with that in mind, can I share with you what you should know about infertility, but have never been told before? Awesome. Here we go. Now, to understand the truth about infertility, we first have to take a step back and understand the broken medical system that we find ourselves in. So now, regardless of whether you're cheering for the repeal of Obamacare or whether you feel it's been the greatest thing since sliced bread, can we agree that we've got a crisis in our healthcare system? Can we agree that our healthcare system, for the most part, doesn't really do what it's supposed to do? That it doesn't create health. 90% of all diseases today are not treatable with orthodox medical procedures. That's according to the World Health Organization. So then what do we have orthodox medical procedures for if they're not helpful for 90% of diseases? Well, we have them for emergency situations, for a crisis. That's the 10% that it is good for. It's very, very good for. For example, an orthodox medical procedure saved my life and my unborn son's life when I got appendicitis while I was pregnant with him. If it wasn't for orthodox medicine, either he or I or both of us would be dead right now. And that's just an unbelievably scary thought for me. So you see, I'm very grateful for what our healthcare system can do for us. And if you get in a car accident or get pneumonia or someone in your family has a stroke or a heart attack, please go to the hospital and let them save your life. Because our healthcare model is great in a crisis situation. But let's be honest. Has this same system that saved my life and my son's life in a time of a health crisis, has it done very well with creating long-term health? Just as an example, think about diabetes. Has orthodox medicine cured diabetes? Now, giving someone a pill to lower their blood sugar manages their diabetes, but it doesn't cure it. All that needs to happen to prove that is for the person to forget to take their pill for one day and their blood sugar shoots through the roof because the pill never cured their diabetes in the first place. It just covered up the symptoms of it, so it made them think their diabetes was cured. But they still have diabetes, don't they? I mean, think about it. Most of us know someone with diabetes. Of the people you know who have had diabetes, how many of them have been cured? How many of them have actually reversed their disease to the point where they can no longer be called a diabetic? It's just not a story you hear very often. But why not? It's because our healthcare system treats the symptoms of disease without actually ever getting rid of the disease itself. This is the basic problem of our broken medical system. We treat the symptoms, but the underlying causes remain. I believe this is why 90% of all diseases are not treatable with orthodox medical procedures. It's because our health insurance system and the orthodox medical procedures that it will pay for are aimed at covering up symptoms like a Band-Aid, instead of curing the reasons we're not healthy in the first place. It really shouldn't even be called health insurance, to be honest. It should be called disease maintenance insurance or maybe Band-Aid care. Because just as we've seen with diabetes, that little plastic card in your purse or wallet, it doesn't actually pay for you to get healthy. It pays for Band-Aids that just cover up the problem and do nothing to bring about true health. So, when it comes to your fertility, what are you looking for? Do you want to rely on a Band-Aid? Or would you like to restore health and vitality to your fertility? If a Band-Aid just doesn't sound like a great idea, then can you see how you're going to need to do something different? Can you see how you're going to need to step outside of the limits of orthodox medicine and the Band-Aid care health insurance that you have and start looking for other answers? Now, some people might think to themselves, well, I don't know. Maybe the Band-Aid approach to infertility works just fine. So let's take a look at the treatment for infertility that our broken healthcare system points to as the best. Let's take a look at the shocking truth about in vitro fertilization, or IVF. Now, for those of you who aren't familiar with IVF, in a nutshell, IVF takes an egg from the wife and a sperm from the husband and uses them to create a baby in a petri dish. And then the resulting baby is implanted back into the wife's uterus, and a pregnancy is supposed to follow. So then let me ask you this. Is IVF aimed at healing the disease of infertility, or is it geared towards covering up the symptoms of it? Clearly, it has nothing to do with healing the underlying causes of infertility. The goal of IVF is to go around the natural ways that pregnancy normally occurs, rather than trying to heal the problems which are preventing pregnancy from happening in the first place. It doesn't care about healing the causes of infertility. It just cares about covering it up. If IVF actually healed the disease of infertility, then a couple would have normal fertility again after IVF, wouldn't they? But for the large number of couples who try IVF and don't get pregnant, their fertility is no better off than when they first started. And for the couples who do conceive, their fertility is not any healthier either. Their fertility is not any healthier either. So IVF doesn't heal infertility or its underlying causes. It just tries to cover it up. Well, all right, maybe it is just a Band-Aid. Who cares as long as you have a baby? But then that just begs the question. How many couples who do IVF actually end up having a baby? So what do you think? Take a guess. What's the percentage of couples who do IVF and actually end up having a baby? You know, the way orthodox medicine talks about it being the best of the best, you might think it's close to 100%. But if there's one basic truth in medicine, it's that nothing in medicine is ever 100%. So what is it? Maybe 90%? 80? 75? Look, I mean, this is it. This is the most cutting edge, most high-tech treatment our healthcare system has to offer for infertility. Surely it's at least 50% effective. No, it's not. Not even 50-50. It's difficult to directly compare pregnancy rates from IVF to pregnancy rates from natural conception, but according to the Society for Assisted Reproductive Technologies website, a couple who begins IVF has about a 43.5% chance of conceiving, although this can vary with age. In other words, more than half of couples who do IVF never have a baby. In fact, there's a research group called the Cochrane Database, and its whole purpose is to take current medical treatments and then look at the existing medical research and see if there's proof that those treatments actually work. So the Cochrane Database, they looked at couples with unexplained infertility, and what they found is that there was insufficient evidence to draw firm conclusions as to whether IVF may be associated with higher live birth rates than expectant management. In other words, there is currently no proof that IVF is better than doing nothing at all for unexplained infertility. Now, considering IVF costs about $15,000 to $20,000 per cycle, that is one expensive Band-Aid. And listen, because IVF is a Band-Aid and doesn't get at the underlying health problems causing infertility, it also creates new health problems. Because you see, babies who are conceived with IVF have twice the rate of birth defects compared to naturally conceived babies. Twice the rate. You know, I was talking the other day with a nurse that I work with on labor and delivery who basically runs a high-risk pregnancy clinic. And she was talking about all the babies with genetic abnormalities that they see in their office. And she was astounded at how many of them are IVF babies. In fact, she was so floored by it that she openly questioned whether IVF should be done at all, purely from the standpoint of the unhealthy babies that it often leads to. Twice the rate of birth defects. That's something that should give you pause. Now, aside from the higher rate of birth defects, IVF babies are also much more likely to be born premature than naturally conceived babies. Do you know what the #1 cause of death and long-term disability is for a newborn baby? Yeah, that's right. It's premature birth. If premature babies survive their prematurity, they're at much higher risk for long-term health problems. Things like permanent brain damage, cerebral palsy, lung problems, developmental delay, all because of preterm birth. And IVF babies are more likely to be born prematurely than babies that are naturally conceived. Now, some of that is due to the fact that twins and triplets are at a higher risk for premature birth, and anywhere from 16 to 32% of IVF pregnancies result in twins or more. But even the singleton IVF babies, even they have a higher risk of premature birth than naturally conceived babies. And so even they are at risk for all the dangers of premature birth. Now, when you throw on top of that moms pregnant through IVF have higher rates of diabetes in pregnancy, they have higher rates of placental problems, and preeclampsia, which is a potentially life-threatening condition, you not only end up with sicker babies, you end up with sicker moms. So here you have this orthodox medical procedure for infertility that doesn't heal the real causes of infertility, leaves more than half of couples with infertility without any hope, hasn't been shown to be any better than doing nothing at all for couples with unexplained infertility, and it creates sicker moms and sicker babies. This is what is wrong with an approach to infertility that just covers up the symptoms instead of curing the underlying factors. This is why the Band-Aid mentality of our broken medical system will never truly help you to heal your fertility. So it should be pretty obvious by now that if you want radical healing for your fertility, it's not going to come from orthodox medical procedures. And you're going to need to look outside the traditional healthcare model. You're going to need to do something different. But how? How do you go about doing that? Well, if you know the two major pitfalls that our healthcare system makes when addressing health problems, then you can step around these landmines and find your way to true healing. So let's talk about what they are and then how we can step around them. The first pitfall is that orthodox medicine puts very little energy into finding out what the underlying causes of an individual couple's fertility are. Some of you have already looked for answers within our broken medical system and asked the question, well, why? Only to be given the answer, unexplained infertility. Unexplained infertility? Well, let me tell you something. There's no such thing as unexplained infertility. God designed our bodies to be fertile. If you can't get pregnant, there's a reason for it. And you can figure those reasons out, but it takes effort, it takes attention to detail, and it takes a systematic approach. And those are things that traditional infertility methods just don't do. Because remember, they're too focused on replacing your natural fertility instead of trying to figure out what's wrong and how to heal it. Now, those of you who have been there before, who have already tried looking for answers, you already know from experience what I'm talking about, don't you? Just as an example, here's what I was taught to do in my OBGYN training when a patient came in with infertility. You check what they call day 3 labs, and we'll talk about just how worthless those are in a minute. You get a semen analysis on the husband, you order a tube study for the wife, and well, maybe you might think about a day 21 progesterone too. And that's it. That's supposed to cover everything that could be wrong. So you make sure everything's okay with the husband. That's good. That's good. And you check to make sure that the tubes are open. That's good too. But then what are these day 3 labs all about? What do they tell you about the underlying causes of infertility? You know what the answer is? Nothing. Not one single thing. The only thing cycle day 3 labs are good for is to help the doctor decide whether they'll allow you to play around for a few cycles of Clomid or maybe artificial insemination before recommending IVF, or if they can just rush you straight away to IVF. And that's all cycle day 3 labs are good for. They are nothing more than a triage for IVF, but they tell you almost nothing about why you can't get pregnant. So then, what's missing from this workup? You check the sperm, you check the tubes. What else is there? Well, what about checking to make sure ovulation is happening normally? You know, sometimes a woman can have a positive ovulation test like this and a rise in their progesterone, and their doctors will say, well, you're ovulating. But their ovulation is still abnormal. Relying on a home ovulation test cannot truly answer the question of whether you are ovulating normally. What about looking for thyroid disease? Thyroid disease, especially Hashimoto's disease, is a very common underlying cause of infertility. What about looking for that? And what about doing it right? You see, most doctors don't know how to properly evaluate the thyroid. Again, poor training from our broken medical system. I know, I was there. What about endometriosis? Low progesterone, autoimmune problems, inflammation. They all play a role in infertility. So why aren't infertility specialists looking for them? It's because, like so much else in our healthcare system, a Band-Aid approach is used. It doesn't really matter what the underlying causes are. The treatments are all the same. You try Clomid for a couple of rounds, and then when that doesn't work because, well, Clomid by itself most of the time isn't going to work, when that doesn't work, then you send them off to a specialist for IVF. Now, if this is all that is ever offered to you, you are never going to learn how to heal your fertility. You will always be dependent on someone else. Doesn't it make sense that before healing begins, you have to know where health broke down in the first place? And don't you want answers to the biggest question that's just nagging at you? Why? Why is this happening? And what can we do about it? You deserve an answer to that, but you're not going to get it from the Orthodox medical community because they really aren't very interested in the answers to those questions. This is the first reason why the current approach to infertility is not going to empower you, because it doesn't look for the root causes. It doesn't help you understand what's happening. Now, the second major pitfall that will keep you from finding healing for your fertility has to do with not realizing that a healthy fertility begins with a healthy body. Here's the problem. Whenever our faulty medical system is considering how to go about addressing any given health problem, it focuses down on a few isolated organs and forgets about the rest of the body that those organs are in communication with. For example, if you have a thyroid problem, like Hashimoto's disease, you see a specialist in hormones, an endocrinologist, and then they focus down right here on this, the thyroid gland. But they never take into account what's going on in the intestines and the gut. Well, that's a problem, because one of the triggers of Hashimoto's disease, one of the known underlying causes of it, is an infection called H. pylori. Well, what does H. pylori infect? I'll give you a hint. It's not the thyroid. That's right, it's the gut. So if a gut infection like H. pylori can cause Hashimoto's disease, but no one's checking the gut to look for it, because, endocrinologists, they deal with hormones. They don't deal with gut issues. How effective is that endocrinologist going to be at healing the Hashimoto's disease when they've got their blinders on and all they're looking at is the thyroid and not taking into account how the rest of the body may be affecting the thyroid? It's not going to work too great, is it? Because look, our bodies are not just a collection of organs tightly sealed in their own little boxes, completely clueless about what's going on in the rest of the body. We have body systems that connect literally every single one of our cells together. We have the nervous system, the hormone system, the immune system. It is literally impossible for one organ system to carry on about its own business, unaffected and unaware of what's going on in the rest of your body. Well, the same sort of problem happens in infertility. Because the typical approach to treating infertility, including IVF, takes a couple like this, and it reduces them down to this. It treats them like reproductive organs contained in nice, neat little boxes, completely untouched by any other health problems the rest of the body may be dealing with. And even worse, IVF treats husband and wife like neat little boxes too. Over here you have the wife box, and what's going on with her really doesn't affect the husband box over here. That's just not how it works. Because a couple's fertility is more than just adding the wife's individual fertility to the husband's individual fertility. So most people know that the egg only lives for about 24 hours after ovulation. And if fertilization doesn't happen in those 24 hours, pregnancy isn't possible. And then some people know that outside of the body, sperm can only live for 30 minutes to a few hours. In a petri dish, maybe as high as 24 hours under the right conditions. But what most people don't realize is that in a couple with healthy fertility, the sperm can live up to 5 days in the woman's body before ovulation, and conception can still happen. That means the window of fertility isn't just 24 hours like most people think. A couple can have intimacy up to 5 days before ovulation and still get pregnant, even though the egg only lives for 24 hours and the sperm for only a few hours on its own. That's the power of your combined fertility when conception occurs through intimacy. It takes it from the narrow window that an individual egg and sperm can survive, and it explodes it to 5 times what any individual spouse's fertility may be. So why would you want to take this supercharged combined fertility and take it back down to a 24-hour window by separating the power of intimacy from conception? Let me ask it this way. All other things being equal, including whether or not you end up having a baby, would you rather conceive your child by being intimate with your spouse? Or would you rather hand over a few body parts and let some emotionally uninvolved lab tech conceive your child for you? If you prefer the second way, then I won't be able to help you. Because I'm not here to put you into a neat little box. And I'm not here to help you cover up an unhealthy fertility. Your fertility is a vital sign for your health in general. A healthy body will have a healthy fertility. That's just the way God designed our bodies. So if you are having difficulty conceiving, that's your body's way of telling you that something's wrong. And some of what's wrong might be in the reproductive organs, but many times some of what's wrong is happening in other areas of the body. And so if you want to heal your fertility, you must heal the body as a whole. Make sense? All right. So by now you must be thinking to yourself, well, great. So how can I avoid these two pitfalls? There are 2 remedies that I use to help you sidestep these traps. The first is a systematic and comprehensive approach that will help you actually find the root causes as to why you are having trouble conceiving. And I say causes and not just cause for a reason. See, I've been doing this for almost 10 years now. And the one thing that holds true for every couple I've ever worked with is that it's never just one thing that's causing difficulty conceiving. It's never just one thing. God designed our bodies to be fertile. And so it takes a whole lot more than just one thing for that to break down. I will sometimes see patients who will say, well, I don't need to do any more testing. I already had a lot of tests done, and they showed I'm not getting pregnant because I have PCOS, or my tubes are blocked, or my husband's sperm count is low. And these same couples are shocked when, after completing the additional testing that I asked them to do, that on top of what they already knew about, they also have endometriosis, or a thyroid problem, or an autoimmune disease, all of which can cause problems with getting pregnant, and all of which are addressed differently from what they knew they already had. And so if the testing that is done to look for root causes takes a minimalist approach and doesn't look any deeper, there is so much important information on how an individual couple can help themselves to conceive that it's never found. And consequently, it stacks the odds against the couple. That's why I use a complete step-by-step method to understanding the underlying causes of infertility that are affecting you personally. And I walk beside you through all of those steps to make it easier for you. Because you shouldn't have to try to figure this out on your own. There's a lot to think about, and it can get confusing sometimes, but armed with the right kind of knowledge, along with an experienced guide, you can find real answers for the questions you have. And that is where the healing begins. The second remedy that I offer to help you avoid the pitfalls of infertility is that I educate you on the things you can do to bring health to your body in such a way that it also brings healing to your fertility. Remember, an unhealthy body will lead to an unhealthy fertility, but a healthy body leads to a healthy fertility. Now, those of you who have already been through some kind of workup or treatment for infertility before, how much time did your doctor spend teaching you about proper nutrition to heal your fertility? What about exercise to optimize your chances of conceiving, or stress management techniques? I'll wager that most of what you know about those things you learned on the internet, which you already know it isn't the most reliable source. I mean, with all the talk about fake news stories going viral on Facebook and other social media sites, we're learning that we have to be very careful about what we should and should not believe from the things we read on the internet. And when it comes to what you should believe and what you should learn about fertility on the internet, I'll help you sift through the truth and the lies. But the question is, why is the internet your main source of information about how to heal your fertility with diet and exercise and stress management? Shouldn't your doctor be the main source of your knowledge in this area? That's why your education on how to heal your fertility is such a large part of our program. We have a whole course, a whole curriculum that teaches you about healthy fertility and the things that you can do yourself to achieve that healthy fertility. We want to empower you to become your own expert in healing your fertility, so that after you have your first baby, you know exactly what to do to keep your fertility healthy for when you're ready for the next baby and the next baby. So that's the second remedy we offer to reverse the faulty thinking that goes with the standard infertility program. With our educational course, we put you in control of your fertility. So we've talked about the two major pitfalls for the standard medical care for infertility that leave you in the dark, not looking for the underlying causes and thinking that infertility is only about the reproductive organs. We've talked about the two remedies that combat these two mistakes, having a comprehensive, systematic approach to finding root causes of infertility, and an educational course that teaches you how to optimize your whole body for fertility. Now I want to share with you a little bit more about the first of these two remedies, the comprehensive step-by-step plan we take to help you unlock the mysteries of your fertility. That plan is based on what I call the 3 keys of healthy fertility. Here's where you can really start to see the power of having a multidimensional, multi-pronged approach when it comes to healing your fertility. Here's where the magic all begins. The first key is naprotechnology. Naprotechnology stands for Natural Procreative Technology. We shorten it up and call it NAPRO. The core principle of NAPRO is to find the underlying causes leading to the difficulty conceiving and then address those causes so that a couple can conceive by their own natural acts of intercourse. So before we get into any sort of treatment, we do a very thorough evaluation. And that evaluation involves a number of things. It involves charting your cycles with a method of fertility awareness called the Creighton model. This charting system is super powerful because it's a record of your fertility in real time. It allows me to help you see certain patterns that are associated with infertility and that would have otherwise gone unnoticed. It helps you time intercourse to maximize your chances of conceiving. It helps to accurately time the comprehensive hormone evaluation we do, and it tracks the improvement of your fertility over time. It's essentially a meter by which you can gauge how healthy your fertility is. Now, once you're charting, we do a comprehensive hormone panel, looking at estrogen and progesterone levels throughout the cycle instead of relying on just a single blood draw. See, a woman's hormones are moving up and down throughout the cycle. So how much information can you possibly get from one blood draw? Not very much. That's why we do such a comprehensive panel, to make sure that we get a full picture of what's going on during the menstrual cycle. Now, we also test for other hormones in other labs that are even not hormones, because those things can affect fertility. Remember, we don't make the classic mistake of looking at just the egg and just the sperm and ignoring the rest of the body. So we look at other areas of the body that can affect fertility and check if they're healthy too with some blood work. In addition to lab work, we also do an ultrasound series to assess if you're ovulating normally. Now, I mentioned earlier, a lot of patients will come to me and they'll say, well, I already know that I ovulate. And when I ask them, well, how do you know? They tell me, because I took a home ovulation test and it was positive. Well, those home ovulation tests, they check for a rise in hormones. So then the question is, can hormones alone tell you whether or not you ovulated? Well, the answer is no, they can't. Now, don't get me wrong, no hormones, no ovulation. But hormones are not enough to tell if you ovulated, because you can have completely normal hormones, but if the ovary doesn't respond to those hormones, ovulation won't occur. For example, you can have a situation where the egg matures, you get the spike in hormones, you get the positive ovulation test, but the egg never gets released from the ovary. We call it a luteinized unruptured follicle. Some people call it trapped egg syndrome because the egg gets trapped in the ovary. Will a luteinized unruptured follicle cause an ovulation test to be positive? Yeah, it will. Because the test is looking at hormones and the hormones are there. But did you actually ovulate? No. Because the ovary didn't respond to the hormones, the egg never even left the ovary and conception doesn't happen. So we don't assume ovulation is happening based on hormones. We actually monitor it with an ultrasound series to find out, do you ovulate? And more importantly, do you ovulate normally? A semen analysis. It's important that we make sure that everything is normal with the husband. You know, sometimes I'll hear women say, well, let's just check me, and then if something's wrong with me, we won't need to check my husband. And in a way, you know, that's a beautiful sentiment, because that's a woman showing love for her husband by protecting him from something that, you know, might make him uncomfortable. But it's also a bit unfortunate because it can lead to a false understanding of what's behind a couple's difficulty conceiving. If you were to take a guess at it, how often is male infertility an underlying cause of a couple's difficulty conceiving? It's about 50 to 60%. Whether or not there are fertility problems with the woman, there's about a 50 to 60% chance that there are fertility issues with the man. So that means if we don't look at a semen analysis, there's a 50 to 60% chance of missing something important. Now, I also understand that testing for male infertility can be embarrassing and even degrading for a man to go through. But let me assure you that I believe it's important to honor the sacredness of marriage. And so we provide a special collection kit that allows the test to be done during intimacy between husband and wife, so that it remains respectful of your relationship as a couple and minimizes any discomfort as much as possible. Finally, a NAPRO evaluation involves a surgical procedure. During this procedure, we check if the tubes are open But we also go a step farther in that we can actually correct a large number of so-called blocked tubes by placing a flexible wire down the tube if dye isn't spilling from it. I've had patients come to me saying their HSG showed a blocked tube, and I was able to open it up with a simple wire. Now, we also take a look with a camera inside the uterus to make sure the place where the baby will be making their home for the next 9 months is healthy and free from inflammation. This test has been shown with research to be the single best test to determine if pregnancy-blocking information is present in the uterine lining. So it's very important. And then finally, we do a robotic laparoscopy, where we place a camera in the belly and we can tell if endometriosis or scar tissue or other fertility-damaging problems are present. And then we can treat those issues using a laser and special measures to prevent scar tissue from forming. And we have great success with restoring normal anatomy, which then leads to healthier fertility. Now, some people who come to me they're reluctant to do the surgery, and they ask me, is it really necessary? And you know, I can understand this because, I mean, no one really wants to have surgery, right? But the truth is, I find something during surgery that's at least one piece of the puzzle, and sometimes a very large piece for some couples, about why they're not conceiving. I find this about 80% of the time that I do surgery. So listen, I never force anyone to do surgery. But the fact of the matter is, choosing not to do surgery means choosing to miss an underlying cause of infertility in 80% of the couples who come to me. So if you really want to find and correct all the underlying causes of infertility, surgery is a very important part of that. So that's the first key to healthy fertility, naprotechnology. And it's a biggie. It's the framework for all we do to help you assess and heal your fertility. It's also the biggest thing that sets us apart from other natural fertility providers. Now, you've heard the saying, can't see the forest for the trees. It means you're so focused on something that you can't see the big picture, right? Well, IVF makes that classic mistake of not seeing the forest, that is our whole person, for their trees, our reproductive system. On the other hand, many natural fertility practitioners can often make the opposite mistake. They see the forest, they see the whole person, but they forget that a pine tree or a maple tree, they have different needs. In other words, they do an excellent job of creating a healthier body, but they are sometimes too focused on a healthy body in general that they don't focus enough on the intricate details and needs of the reproductive organs specifically. This is where our program, and NAPRO in particular, can really bring the best of both worlds to you. I help you bring health to your entire person so that you can have a healthy fertility. But I also understand the intricate details of the reproductive system and can guide you to make sure that it receives the critical healing it deserves. And when you combine a healthy body with a maximized reproductive system, this is like rocket fuel for your fertility. This is when things get really exciting. And I'm telling you, it's just amazing to watch a couple go through this really life-changing experience. The second key of healthy fertility is detoxification. If you want to heal your fertility, you desperately need an effective detox program. Now, I can't possibly go into all the details about the ways that toxins damage your fertility right now. That's something you'll learn about in detail in our curriculum on how to heal your fertility. But toxins affect so much. I mean, they affect hormones. They affect how your body responds to those hormones. They damage eggs, they damage sperm, they cause miscarriages, and it increases babies' risk for things like autism and other serious health conditions. And if you know you have certain conditions like endometriosis, PCOS, premature ovarian failure, or sperm abnormalities, then you especially need to detox because toxins play a role in all of those. And here's the thing. No one is ever able to completely avoid toxins. Now, you certainly should try, but I don't care if you walk around dressed up like this, okay? It's impossible to completely avoid every toxin. You certainly need to do the best you can, and we'll teach you how to do that, but it's an understatement to say that all couples trying to conceive need a detox. both to be able to conceive as well as to have a healthy pregnancy and a healthy baby. And both husband and wife need the detox because toxins affect a man's fertility every bit as much as they affect a woman's. And I'll be honest with you though, I used to not feel so strongly about detoxification. In times past, actually, detoxification was something that I kind of rolled my eyes down and kind of huffed about. Because it always involved drinking nothing but spicy lemonade or green juice or taking some 10-day liver cleanse or 30-day colon cleanse that you bought from the health food store. And in the end, all I ever saw it do was make the person feel really tired, have diarrhea, maybe lose a few pounds, but they always put it back on right after the cleanse was over anyways. And they might feel great for about a week or so, but then they were right back to where they started from. So I've never been a huge fan of traditional detoxification because I didn't see people getting dramatically better from it. And even though there's toxins all around us, and even though it's well documented the dramatic impact they have on fertility, I never saw a truly effective detoxification program that I could get behind. Until now. In our office, we've got the absolute best detoxification program ever. It's called True Cellular Detox. It gets rid of everything. Heavy metals, pesticides, toxins from plastic, everything. And it can even pull these toxins out of the pituitary, which is critical for fertility and is traditionally a very difficult place for toxins to be removed from. It is truly a game changer when it comes to healing your fertility. So naprotechnology and detoxification, these are the first two keys to a healthy fertility. Fertility fuel. Fertility fuel is the third key of healthy fertility. Fertility fuel is a synergy, a powerful gathering of the things which not only make for optimal health for your entire body, but also create the best health for your fertility. There are a number of things which make up fertility fuel. Nutrition, for example. According to Hippocrates, who's considered the father of modern medicine, all disease begins in the gut. Well, it stands to reason that if all disease begins in the gut, then healing should begin there too. This is where the nutrition part of fertility fuel comes into play. If you eat food that damages your body and your health, swallowing a bunch of medications and supplements is not going to be able to fix that damage. You can't abuse your body like that and expect it to respond in a healthy and normal manner, right? I mean, even if you take the right medications and supplements to address the underlying causes of your infertility, you have to treat your body right, or those things are useless. Now, that doesn't mean that medications and supplements aren't necessary, and I use both when the situation calls for it. But feeding your body with the right foods to give it proper energy goes way beyond what any supplement or pill can accomplish on its own. We know certain vitamins and nutrients are great for fertility, but when you get those things in foods, instead of relying only on supplements to do it for you, the effects are much more powerful. If you fuel the body the right way, your cells will heal themselves. And as your cells heal themselves, your entire body will heal itself too, including your fertility. But if you feed your body junk, you can't expect supplements to undo the damage that causes. And I'll help you figure out what diet works best for you personally, because there's no such thing as one fertility diet that is right for everyone. I'll teach you some basic principles of nutrition that are healing for everyone, but I'll also help you to figure out what works best for you. Exercise. Exercise is an important part of fertility fuel because the benefits of exercise go way beyond heart health, better energy, better mood. Exercise gets the blood flowing, including the blood flow to the reproductive system. Now, this means that all those great nutrients that you're feeding your body get to where they need to go the most to heal your fertility. But there's a flip side to exercise, and that's you can exercise too much. Yes, I'm talking to you, all of my overachievers out there. It's called overtraining. And when you overtrain, you stress your body to the point that you rob it of the energy that it needs to repair itself. In women especially, egg quality is highly dependent on energy production. So if you're sapping your body's energy with overtraining, You're going to rob your fertility the energy it needs to be healthy. In our curriculum, we'll teach you the most effective way to exercise to get the best benefits from it. And I promise it won't eat up your time. If you can find 10 minutes 3 times a week, that is all the time you need for fertility healing exercise. And for you elite athletes who love to exercise and want to spend more time doing it, we'll teach you how to know when you can push it and when you need to take it down a notch or even take a rest day. And you'll be surprised to find out that not only will that help with healing your fertility, but knowing when your body can handle more intense exercise and when it needs rest will also help you crush it when you do go all out. And finally, stress management. This is a vital part of fertility fuel. And I saved this one for last because I didn't want you to completely shut down when I tell you the obvious, that stress affects fertility. There was a study done in 2011 that showed that women with an overactive stress response in their nervous system were far less likely to conceive than those with a lower stress response. Now, this can be hard to hear, I understand, because really, who doesn't have stress? I mean, physical, emotional, mental, spiritual, we all have stress in one way or another, and it can powerfully impact fertility. I mean, think about it. It's not uncommon to hear stories about couples who decide to adopt after years of unsuccessful infertility treatments, only to find themselves with a surprise pregnancy. But why? It's because in addition to all the other sources of stress in our lives, infertility itself is a stress. And for some couples, that stress can kill their fertility. So unless you manage stress, it will kill your fertility too. Now, most of the time, we can't control the stress that comes our way, but we can control what we do with the stress we're given. And we can teach you certain techniques to handle that very effectively. But you need to understand just how powerfully stress affects fertility and put what we teach you into action. So that's it. That's the 3 keys of healthy fertility: naprotechnology, detoxification, and fertility fuel. When you incorporate all of them together, you will end up unlocking your full fertility potential. And that's why we're able to see the results that we see with our patients. Because we beat out IVF with a 45% pregnancy rate in the first year and a 65% rate after 2 years. And even if pregnancy doesn't occur, couples still experience enhanced health and well-being that improves their quality of life compared to before they began the program. For your fertility, for your health, it's really an empowering journey. Now that was a whole lot of information we just went through. You now know more than most OBGYNs know about fertility. But that being said, would it be a good idea for me to just send you on your way with all this information to try and figure it out all on your own? I've spoken in generalities here about how to heal fertility, but generalities only get you so far. You need to know how to apply this information specifically to you. You need more than just generalities. What you need is a personalized plan of action and someone to help you along the way, a guide, a mentor. Why? Because without a mentor to guide you, trying to put it all together on your own, well, it might end up looking something like this. It just might not make a whole lot of sense. Think about it this way. If you want to learn to fly a plane, could you do it after just reading a book about it? Now all the husbands out there are going, yeah, I could do that. And I wouldn't even need that manual either. But seriously, is information all you need to learn to fly a plane? If I handed you a book on how to fly, would you feel comfortable just jumping in the cockpit and taking off on your own? What else might you need? You'd need an instructor, right? Someone who can sit next to you in the cockpit, teach you how the controls for that plane work, help you take off for the first time, guide you through any turbulence on the flight, and then land safely back again. That's what a mentor does for you. And that's what my role is. With my curriculum on how to heal your fertility, I'm going to teach you the basics of healthy fertility. That's going to be your flying manual. But then I'm also going to help you make sense of all the information in the manual by showing how it applies to you specifically. That's me taking you through everything prior to takeoff. And I'll help you put into action a plan that is tailor-made for healing your fertility and keep you from crashing right off the bat. I'll be there if that plan of healing gets a little bumpy and you need some help to change to a smoother course. And when you get pregnant, I'll be making sure that you and baby are supported so that you land safely at a healthy delivery. This is how you can begin to heal your fertility. Not with information alone, but with a mentor to help you put it into action. Now, some of you are not yet ready for a mentor. You may just be in an information gathering stage at this point. But at some point, you're going to need to take all of this knowledge and put it into action, or it's not going to do you any good. You know, when I played softball as a kid, I was really good at batting practice. I knew exactly how to connect with the ball just right. But when I first started out, I was so terrified during an actual game that I wouldn't even swing at anything. I'd just stand there and pray that they'd walk me. And my dad, he used to try to encourage me by saying, honey, 100% of the swings you don't take will never go for home runs. Well, it's kind of like that with knowledge. You can have all the information in the world, and sooner or later, you're going to have to act on that information, or you're never going to hit that home run, right? And I'll be honest with you. You're going to want to put this information that you learned here into action sooner rather than later. Because one of the most difficult things about fertility is that it definitely decreases with the passing of time. And that getting back what time has stolen is very difficult. And so knowing that, are you ready to take action now and not let time get in the way of healing your fertility? Because I would assume you're still watching at this point, not simply because you're looking for an endless stream of information. I would assume that what you're actually looking for is help. Is that a fair assumption? So can I offer you that help? You can stop this now if you don't want my help. But if you're ready to jump into action, then can I show you how you can do that right now? Outstanding. Here's what you're going to do. You can send us a request for a consult through our website. My staff will get you set up with an appointment time for when you and your husband can both be with you for the visit. Now, we do require that both husband and wife come to the initial consult for the same reason I asked you to grab your husband or your wife and watch this video with you. It's so that the two of you can stay united in your journey towards healing your fertility. I'll review the paperwork that you filled out ahead of time before we meet so that I have a good understanding of where you're at in your journey. Then you and I will sit down together and we'll talk about your unique situation, your hopes for your fertility, and we'll talk about how we can help you meet those goals. And we're going to have plenty of time together. I'm going to set aside an hour of time just for you. So you'll have plenty of time to decide if you feel like this path is the one you want to take to heal your fertility. And at that point, if I decide to accept your care, my staff and I will welcome you to the Mystical Rose family. You'll be introduced to your own personal care contact, and your path to successfully healing your fertility begins. Now, does that sound like something you'd be interested in? Like something that would be a valuable investment to you? I can tell you that my typical fee for a consult is $300. But for everyone who listens to this talk, I'm going to reduce that consult fee to just $87. And why do I do that? I have plenty of couples who have paid the $300 to come see me. So why do I cut it down to just $87 for you? Well, you've taken the time to listen to this whole presentation, and that tells me you're serious about healing your fertility. So I want to honor the effort you made here and make the next step forward easier for you by reducing my usual fee. But I will say this. I can only give this special rate for those who are ready to jump into action within 24 hours of viewing this talk. And why is that? Well, there are a lot of patients who want answers about their fertility. And because I take my time, not only with the couples who meet with me for the first time, but also with the couples I'm already committed to mentoring. Because I do that, I can only meet with and accept a limited number of new couples into my practice. And so you can meet with me right now for only $87, or you can meet with me later for $300, if there are any spots left. And I'll tell you, usually there aren't any spots left. So if you want to lock in your consult time, be sure to contact my office right away. Now, as I said, I really take time with my patients because I believe it's what patients deserve to maximize their health. The only downside to that is that I have to restrict the number of new patients I accept into my practice so I can keep that high level of personal attention. And so I'll be honest with you, I don't accept every patient who meets with me for that 1-hour consult into the practice. As much as I would like to, I simply can't do it. So because I have to restrict the number of new patients that I accept, I'm very careful to make sure that I only accept the couples I know I can help. And how do I know which couples I can help? By listening to you at our first consult together. There are couples who come in highly motivated to make the changes it takes to heal their fertility. They're fast learners, put their learning into practice with enthusiasm, and they get phenomenal results. And there are couples who are super enthusiastic, great learners, but they may need a little more help putting everything into practice. They need a little more support along the way, and they get phenomenal results too. And these are the couples that I accept into my practice. Because on a scale of 1 to 10, their dedication to healing their fertility is an 8 or a 9 or even a 10. But couples who, for whatever reason, are not quite as ready, who may be great learners and information gatherers, but never take the time to put what they learn to work for them, or who only want to do NAPRA technology, but not take the time for detoxification, or they don't want to change their nutrition to maximize their fertility. These are couples I don't accept into my practice because they're just not ready yet. But if you're an 8 or a 9 or a 10, and I still have enough space to accept you into the practice, then you are going to see amazing benefits for your health and for your fertility. So, in preparation for our visit together, remember that both you and your spouse must come together to the consult. If something happens and something comes up and your spouse can't make it, no problem. Just let us know, and we'll get you rescheduled for a time when you can both make it. We will need you to prepay the $87 so we can lock you into one of our limited spots. That just lets us know that you're going to be there and that we're giving the spot to the right person. So have your form of payment ready when you reserve your appointment. We do ask that you please be on time. We recognize that many of you may be coming from a distance and traffic can be a problem sometimes, and we try to accommodate you as much as possible. But if you're more than 15 minutes late, we will need to reschedule your visit. And finally, please have your paperwork filled out completely before your visit. That way we get the most out of our time together instead of having you sitting in the waiting room filling out paperwork. Now, a few common questions that people have. Will my insurance cover this? Well, remember what we talked about at the beginning, that your health insurance really isn't health insurance. It's disease maintenance insurance or Band-Aid care. And since our program is neither a Band-Aid nor designed to maintain disease, most of it will not be covered by your insurance. So you'll need to decide. Do you accept the disease maintenance only approach that your insurance pays for? Or do you realize that your health and your fertility are much more valuable than that and are worth making an investment in? I can tell you that the average couple that comes to me, they're not rich, they're not well-to-do, and we don't have a problem getting them into an effective program that's affordable for them. Another common question, some couples want to know if they can do my program at the same time that they go through IVF or intrauterine insemination. Well, as I explained in the talk, IVF and really intrauterine insemination too, they just have a completely different philosophy of health and fertility. Those methods seek to override and dominate the reproductive system, while our approach is to heal, restore, and cooperate with the body's natural fertility. So at a basic level, they're just totally incompatible with one another. And for that reason, I don't work with couples who are actively going through those treatments. Now, if you've tried those things and they failed you, I would love to work with you and show you the tremendous healing capabilities that the body has, especially when it comes to fertility. And then finally, if you do go through this program, can I promise you a baby? Well, no. No one can promise you that. And if someone does, you need to be looking really hard for the catch, because I can guarantee you there is a catch. Some IVF programs will say they guarantee you a baby or your money back. But this doesn't apply to you if you're over 38, or if you're too overweight, too underweight, don't meet strict lab criteria, if you've had more than 2 miscarriages, or previously failed IVF attempts, and in some cases, they can just flat out cancel the guarantee when you don't respond to their medications the way they thought you would. So it's not much of a guarantee when it excludes so many couples seeking help for infertility and can just be canceled when things don't go as expected. So listen, regardless of what you do, no one can ever guarantee you a baby. But if a baby is your goal, then I can promise you that healing the underlying causes of your infertility is the absolute best way to get there. And if I accept you into our practice, I know, beyond a shadow of a doubt, I know that your fertility will be healthier than when you first came in. And a baby will often follow from that. And so I just want to leave you with this final thought. That I know the tremendous healing capabilities that God has given our bodies. And that those healing capabilities extend even to fertility. If you remember that we are a whole person, body and soul, and not just a few body parts. And so right now I have a simple question for you. Does what we talked about make sense to you? Do you want to understand and heal your fertility rather than just cover it up? If so, then contact my office right now and let's take that first step together. Thanks for listening, and God bless.